Hello, everyone. Today I will be talking about urinary tract infections. I hope that you will enjoy this topic. First and foremost, let's take a look at the urinary tract. Briefly, the urinary tract consists of kidneys, ureters, bladder, and a urethra. Typically, the urinary tract is resistant to colonization. However, the urethral mucosa and the renal medulla are the exceptions. Despite this, the urinary tract efficiently and quickly removes both virulent and avirulent microorganisms. Now, back to definitions. Urinary tract infection refers to a spectrum of diseases caused by microbial invasion of the urinary tract that extends from the renal cortex of the kidney, the urethral meatus. Urinary tract infections are categorized into upper urinary tract infections and lower urinary tract infections. Now, let us take a look at upper urinary tract infections. A urinary tract infection that is limited to the renal parenchyma or ureters is called an upper urinary tract infection. When an upper urinary tract infection is limited to the renal parenchyma, it is referred to as pyelonephritis. When it is limited to the ureters, it is referred to as uretitis. It is important to note that upper urinary tract infections occur as a result of an ascending infection from the lower urinary tract. So how does upper urinary tract infections manifest? The patient with an upper urinary tract will present with flank pain or tenderness as well as fever. Remember what I said earlier. Upper urinary tract infections occur as a result of an ascending infection from the lower urinary tract. So signs and symptoms of lower urinary tract infection will occur. Let us now focus our attention to lower urinary tract infections. Lower urinary tract infections by definition are limited to the urethra, bladder, and in males the prostate. They present with dysuria, increased frequency, urgency, and suprapubic tenderness. Let us now explore the clinical classification of UTIs. Let's start with a single episode urinary tract infection, which occurs only once and does not recur. Second is the recurrent urinary tract infection, where patients repeated episodes of bacteriuria with or without clinical manifestations. Still on clinical classifications of urinary tract infections. Next is complicated urinary tract infection, which occur in individuals with one or more structural or functional genitourinary abnormalities or have indwelling catheters and whose conditions cannot be controlled with therapy. And finally, uncomplicated UTI, which primarily occur in sexually active young women with normal genitourinary tracts and no prior instrumentation, and are usually caused by antibiotic-susceptible bacteria. Etiological agents of UTIs. The microorganisms responsible are the following: Escherichia coli, Pseudomonas, Proteus, Klebsiella, Enterobacter species, Staphylococcus saprophyticus, Enterococci, Corynebacterium ureolyticum, and fungi. It is important to remember that complicated infections are often polymicrobic, involve renal stones, and can yield urine cultures that are positive for multi-drug resistant organisms. Treatment of urinary tract infections: antimicrobials, urine alkalizers, which neutralize the acidity of urine antiseptics, especially for recurrent urinary tract infections. Fluids to flush infection out of the urinary system. Thank you for listening. I hope this topic was helpful. Please don't forget to like and subscribe.